Okay, so we're going to talk about natural remedies for hot flashes. Dr. Gates and I just did about a 40-minute broadcast on hot flashes, and it was entitled Going Beyond Hormone Replacement Therapy. So I can just refer to that.
Mm-hmm.
That would be that, right?
It's on PowerHealth.com.
But we're going to put it down to a little blurb for you so that you can maybe not have to watch through that whole thing. But if you really want the whole skinny of what we're about to talk about, essentially hot flashes are, in our world, technically, in my world, in my estimation, I wouldn't consider it a lack of estrogen, or I wouldn't consider it a menopausal problem, which sounds insane, but that's how we look at it. And hot flashes are secondary to other imbalances in the body that are creating the concept in your physiology that your physiology needs to heat your body up. And so you get this heat flash. It has a lot to do with stress, has a lot to do with the infamous adrenal gland, and a long-term successful treatment probably has a lot less to do with hormone replacement therapy than you might think, based on the fact that that is the #1 therapy in this country. So going beyond that hormone replacement therapy and some natural treatments, I'm going to kind of defer to Dr. Gates, because this is an area that he's very conversant in and excited about. So I'll let him kind of take it from there.
Well, the interesting thing about hot flashes is that it's now being shown that the hot flash mechanism is actually coming from the brain. And so we do know that the ovaries, as someone reaches menopause, tend to produce less estrogen and progesterone. And we also know that if we give that person estrogen and progesterone, lots of times their hot flashes go away. Not much is understood beyond that until recently. And what we see is that when the ovaries start to produce less estrogen and progesterone, the brain tries to compensate. So it starts sending a lot of signals to the ovaries saying, come on, ovaries, let's work. And because the ovaries don't work, the brain starts sending other signals, like to the adrenal glands, and the brain initiates a stress response. And with that stress response, part of a stress response can be to heat the body up, kind of like if you're standing out in cold weather naked, you'd start to shiver, you would do things to increase heat. Well, we're seeing kind of a similar mechanism, not exactly, okay, I can go into the specifics for any of you who really want to know, but a similar mechanism occurs in hot flash patients, or patients with hot flashes. And we also see changes in blood vessel diameter, which creates the flushing, so on and so forth. So going towards natural treatments, we know that people who take hormone replacement therapy have a variety of health risks. You're only supposed to be on hormone replacement therapy now for 3 to 6 months or 60 to 90 days, depends on the estimate. However, commonly we see patients who are still on it for 10, 20 years, and they're going to stay on it because it helps them to feel better. When someone's on hormone replacement therapy for that long, their chance of stroke goes up by a couple times, their chance of dementia goes up 2 to 3 times, their chances of breast cancer increase precipitously, especially for those of you out there with breast cancer suffering with hot flashes. You can't take hormone replacement therapy because that can basically cause the cancer.
And the catch-22 in that is, in the medical model, technically you're kind of now hooked on it.
Right, exactly.
If you come off of it, you don't feel good. So your only choice is to go back on it and then incur all of these risk factors.
Mm-hmm. So the natural treatment approach is to get your brain out of a stress-based response. Many of us have been stressed out for 20, 50 years, not really knowing it, just kind of going through life. But if you really sit down and think about your life, you can say, oh yeah, I was working 80 hours a week for 20 years. I was under some stress. And your brain is in that stress-based response. So we work with something termed neuroplasticity here, which is where we teach the brain to change. It is possible now. Look it up. We try to reprogram the brain out of these stressful circuits, and we do that as well as managing the adrenal glands. We allow the adrenal glands to not only make stress hormones, but also to make other hormones that are associated with sex hormones that we now see can help to regulate all the other female hormones without hormone replacement therapy. It's very, very interesting. It's very, very exciting. So we have had a number of patients who are here for a number of other reasons who ultimately have hot flashes where they end up going away. And it's primarily because of the things I just mentioned, calming down the stress response, dealing with the adrenal glands, but also addressing all the other factors that disturb the system, like the person's food intake, like their blood sugar levels, which are now being associated with hot flashes, high and low, as well as their nutrition, as well as their ability to make energy so their adrenals don't have to compensate for that, as well as their other hormonal profiles, toxins, things of that nature. So that's what I would say relative to the natural treatments. Did you have anything else you wanted to expand upon?
Yeah, relative to the natural treatments, a lot of patients come in here for other things, as Dr. Gates said, but they have hot flashes along with it. I think what he's articulating is those other things, that the stress of the brain affecting the stress of the adrenal glands, those are the two main players in hot flashes. What stresses out the adrenal glands? Everything. So if we have somebody who comes in here with fibromyalgia, for those of you who don't know much about fibromyalgia or whatever, we find that most of those folks have a severe thyroid problem, usually something called Hashimoto's. Frequently they'll find they have gut problems. Frequently that's called celiac. We'll find out that they have a variety of other issues. And all of those issues are creating the stress that Dr. Gates talks about, in addition, the stress on the adrenal in addition to the brain stress. And what he's saying is at least 50% of the time, in treating all of those, the hot flashes will go away. So, and the reason I mentioned that is because a lot of people come in here and they say, well, I'm taking this herb and I'm taking that botanical and it's helping me, and I'm taking DHEA and that's helping me, and so on and so forth. But really, those are short-term. Even though they may not be the hormone replacement therapy, those are relatively short-term solutions unless you handle all the other stresses. And those of you who have tried those short-term solutions and they didn't work, might work if you were aware of calming down your brain and were aware of calming down these other issues. So it's a little bit more complex than taking estrogen therapy. It makes you feel better. But as with anything else that seems like it's an easy therapy, an herb, even an herb, I'm not anti-herbs and I'm not anti-drugs, but we're just saying that a better long-term therapy is to understand the stress mechanisms and understand that your thyroid, that anything that's creating an infection, an inflammation, anything that's causing a nutritional imbalance, anything that's causing your body a viral infection, anything that's doing that, is causing stress on your adrenals, and is probably contributing to you ultimately having hot flashes. And this is the physiology of it. It just doesn't fit nicely into any model that's out there today. And so that's what you're up against when you're taking these herbs or the medications and they're not working. It's these other things. And even if they are working, you probably want to look at these other things relative to creating a long-term solution where you don't have to keep taking drugs, or maybe even don't you have to keep taking herbs, because the less you need to take, the better, more cost-effective, more likely it is you'll be able to maintain a nice non-hot flashy state. So that's what that would be my takeaway message on this, and I hope you can grasp that, because that's really the solution to so many of these chronic problems that people are having today, is looking at it from more of a complete whole body, whole biochemistry, perspective, and stress perspective. So I think that really kind of covers it. You can do your closing.
So we have the full broadcast for about 45 minutes on powerhealthtalk.com regarding beyond hormone replacement therapy, hot flashes. And you can take a look at that and get a more detailed preview of what we're talking about here. Thank you for watching, and forward any questions to us as well on powerhealthtalk.com.
Yes, please do that.
Thank you.